Hi, everyone. My name is Kelsey Shane. I'm the Marketing Director at the Canadian Digestive Health Foundation, and I'd like to welcome you all to our webinar this evening on medical cannabis. Tonight is our third and final webinar in our three-part medical cannabis series. This evening, we are lucky enough to be hearing from three patients, Jennifer G., Clint, and Jennifer O., who are currently using medical cannabis as part of their treatment for their conditions. Just a quick note. If you weren't able to see the other webinars in our cannabis series, they are online at cdhf.ca, so be sure to check those ones out. So for those who don't know CDHF, we are the official foundation of the Canadian Association of Gastroenterology, which means we're directly connected to Canada's leading digestive health experts, physicians, scientists, and other healthcare professionals. So you can trust us to provide you with practical science-based information that is up-to-date and unbiased. This webinar has been made possible through an unrestricted educational grant from Spectrum Therapeutics. So thank you, Spectrum, for allowing us to shed some light on patient experiences this evening. Just a few housekeeping notes quickly. This is a live presentation. During it, if any questions come to mind, please enter your questions in the question box at the bottom right-hand side of the screen. Questions will be addressed at the end of the presentation. If you have a question for a specific individual, please be sure to mention their name so I can direct it accordingly. And if you do not see the forum, click the Ask a Question hand icon on the top right of the screen. If you need technical support, you can also click the Help button and someone will be standing by to help you. Our presenter this evening is Dr. Schneider. If you weren't on the two webinars before, you may not know him. So he is the Assistant Professor of Gastroenterology at the University of Manitoba in Winnipeg. His practice mostly involves the treatment of patients with IBS, Crohn's, colitis, and liver disease. And he has been one of the major voices advocating for an evidence-based approach to cannabis therapies. So without further ado, I would like to welcome Dr. Schneider.
Hello, welcome everyone. So this is the last series in our, the last episode of our series in the cannabis webinars. And so the first one we did, if you didn't have a chance to check, we looked at the difference between recreational and medical cannabis and tried to give the audience tools to decide which method was right for them. Then we went on to do a webinar which addressed the evidence for medicinal cannabis in certain conditions. It looked at the specific studies and drew conclusions from the studies to see if it was worthwhile using cannabis in those conditions or not. Now this one, we're going to focus on the patients and the people who've actually used, in this case, it's patients, it's medicinal cannabis, and what their experiences were. So at the point is, so if someone has gone down the whole route, they did the assessment whether recreational or medicinal cannabis was right for them. They decided to go for the medicinal cannabis, and there was evidence to support that. Then what happens is the physician creates an authorization form. It can be quite a tedious form depending on which licensed producer is used, but it's filled out by the physician. Certain parameters can be set. However, if it's something especially for pain management, typically it's most physicians will leave it quite open, and it'll be for the patient, up to the patient to decide what dose, which dosage form, and is right for them. The two main requirements that the physician absolutely has to set is how many grams per day is the patient going to take, so dried leaf or the equivalent of oil or capsules. And what the duration should be. The maximum duration that you can authorize medicinal cannabis in Canada is 12 months. And most physicians will typically do it for about 3 months and then reassess it after 3 months to see if it's working or not for the patient. So let's pretend somebody did go down the medical route and they were given an authorization for medicinal cannabis. And the physician allowed them to go, didn't put on very many restrictive parameters and allowed the patient to choose, to try different therapies and choose what was right for them. So this next slide just sort of shows the evidence. So the typical ones, and this is what was talked about during our cannabis laying out the evidence webinar. But there's basically two categories you have to consider medicinal cannabis. There's one where the substantial evidence, or people call it slam dunk evidence, where there is it's irrefutable that medicinal cannabis is equivalent to conventional therapies. And then there's a whole bunch of categories where there's limited evidence. So there are smaller studies or studies that are retrospective, which show benefit to medicinal cannabis. However, they're not strong enough to draw major conclusions and absolutely change practice in those areas. So it depends, which category you fall on, and that sort of, it's not inappropriate to in certain situations to give medicinal cannabis where there's limited evidence. In fact, that's often done. But there's definitely the government and the colleges will be very unlikely to reassess someone's authorization in the substantive evidence categories. So the first question is what licensed producer are you going to use? So unlike normal pharmaceuticals where the physician writes a prescription and gives it to the patient or faxes it to the patient's pharmacy that they want the prescription faxed to, and the patient goes to the pharmacy and the pharmacist basically gives the patient, especially if it's a generic medication, it can be from any company, and it's whoever the pharmacy bought the medication from. There could be a prescription where the physician says no substitution and absolutely wants the commercial brand, which is typically more expensive, but there are certain reasons for that in some situations. And then the pharmacist will dispense the medication to the patient. But there's never any connection between the physician and the pharmaceutical company, nor the patient and the pharmaceutical company. In the medicinal cannabis space, it's completely different, where the physician is required to send the authorization directly to the grower and the producer of medicinal cannabis, and the patient orders it directly from the licensed producer. Now, it makes it kind of this is one of the reasons I think many physicians are quite uncomfortable prescribing medicinal cannabis, because there's a lots of sort of concern from the patient side that physicians, may be bought off by pharmaceutical companies or not, not acting in necessarily their best interest. And so there's lots of efforts done by physicians, at least the physicians that I work with, to try to distance themselves as much as possible from the pharmaceutical companies. And so it's to limit interaction with the representatives, to prescribe generics first, and with the pharmacy barrier, that does create a nice barrier. So there's not really any communication directly with the physician. Difference in the medicinal cannabis space, the physician is required. You can't send it to a pharmacy. They're required to send it directly to the pharmaceutical company, the licensed producer, they call it in the cannabis area. And so how do you choose which licensed producer it is? And so I think if the patient, if you had done some research beforehand and knew which licensed producer you wanted to work with first, that could be quite helpful. And then you could help guide the physician. And it'd be, the physician most likely would not have any objection to send it to the licensed producer of your choice. However, there are, if there's sort of no preference, then it's up to the physician to decide which licensed producer to send it to. And usually, I find most physicians who are prescribing medicinal cannabis, they prescribe it to whichever licensed producer hasn't given them a lot of grief in the past, meaning that they've accepted their forms as they are, because unfortunately some of the licensed producers, because they're trying to remain compliant with Health Canada, if there's any little mistake on the authorization form, they will send it back to you, and then you'll try to correct that, and then send it back, and they'll say, this correction's still not correct, it's not right. And so you end up wasting a ton of time working with them. So your appetite for working with those companies that made your life difficult is less. The other thing is the physician will, the other way that their licensed producers create more work is when they don't have any supply, and especially at the start of it's getting better now, but in the start of 2018. And especially when at the end of 2018, when there was the recreational cannabis came, there was a chronic shortage of supply. So you would prescribe this, and then the patient would come back to you, and they'd say, everything's sold out on the patient portal with licensed producer. Can you send me to another one? And then you have to fill out a whole other form and send it to another one. So typically, those are sort of, at least for me, the metrics that I was using to try to make things easier and make sure the patient wasn't wasting their time, I wasn't getting my time wasted by making sure there was actually supply for these patients. However, there are some very interesting products and different formulations made by some of the different licensed producers. So as you get more knowledgeable in the space, then there are certain reasons why you would send, where you think a certain product would be helpful for, and more advantageous for a certain patient's condition, then you would send it more to that licensed producer. The second thing is then after that, after the form is faxed into the patient, into the licensed producer, the patient will be contacted by the licensed producer. The patient will set up with a patient portal. The patient will log in, and then every single product the licensed producer has that has been authorized for the patient will be available for the patient to use. So in the example of an unrestricted authorization, let's say you're going with Canopy or Spectrum Therapeutics, they would offer, the patient would be able to order any product that was in stock with Spectrum. However, if there were restrictions put on, for example, CBD only containing compounds, no THC, that would be only the ones that were CBD only would appear on the patient portal. They wouldn't even see the THC containing products. After that, the patient has to, so using the hypothetical that the patient didn't have any restrictions, the second choice is what kind of strain do you want to use? So the two main strains that are talked about and are used as categorization with the licensed producers, there's sativa or indica, and those they're different plants. Sativas come more from the equatorial area. They're a lot lighter, they're a lighter green, and they grow much higher. And the leaves are spread out much more compared to the indicas, which typically come from the Himalaya region, and as well as the former Persian Empire, and so Afghanistan and Iran. And they're a lot smaller plant, a lot darker green, and a lot thicker and less interspersed, less internodal space on the leaves. And that's just a plant characteristic. But for the medicinal cannabis user, what's important to them is what these two strains represent is the different terpene profiles. And so typically the sativas will give someone more of an energetic feeling after using, whereas the indicas will give more of a calming, relaxing, the classic couch lock feeling. And but that's based on the terpene profile. And as cannabis medicine becomes more sophisticated, and physicians as well as patients become more knowledgeable in the area, the licensed producers are likely going to separate it. Rather than being very simplistic with a sativa versus an indica, they're going to separate it between the terpene profile. So you'll be able to say, these terpenes are what I'm looking for, and this strain has all these terpenes, and who cares whether it's an indica or a sativa. Then after that, you have to decide on the dose. Now, if let's say you're authorized for 1 gram per day of it's just of cannabis in general, then there's a difference between the CBD and THC. So how many milligrams of THC or CBD do you want? That's measured up to the milligram level on the oils and the capsules, and what ratio do you want? And so the THC is a psychoactive component of the cannabis plant. The CBD is considered more of the body high that people get. So the not psychoactive, but can definitely decrease pain and give a sense of well-being on the body level. The delivery mode is also another consideration the patient will have to decide when ordering their product on the patient portal. There's tinctures, there's dried flower, of course, there's sprays, there's and gel capsules, and so that's all sort of a delivery mode. So there's many, especially if there's no parameters put on the authorization, there's many decisions the patient will have to make in deciding once they're authorized, in deciding with the licensed producer what product they want to order. And then after that, they'll be delivered via Canada Post right to their house. So we'll start off with Jennifer O, who's suffering with gastroparesis. So it's Jennifer. How's it going?
Hi, it's going okay today.
Yeah, good. Thanks for joining us on the webinar.
You're welcome.
So can you tell us about yourself a bit? So you can just tell us sort of who you are and just tell us about your symptoms and sort of what you feel, and sort of maybe just tell us just a little bit more about gastroparesis as well, and your perception of what you're living with gastroparesis.
Yeah, for sure. So I'm 32. I was diagnosed with gastroparesis when I was 18 back in 2005. For those of you who aren't familiar with what gastroparesis is, it's often referred to kind of as delayed gastric emptying or paralysis of the stomach. So basically, normal person will eat, their food will start to digest. Somebody with gastroparesis has that delay in digesting. The muscles don't contract to move the food along the digestive tract. So with that comes a lot of different symptoms, and I've experienced the full spectrum of them over the years. There's a lot of nausea associated with it. Some people vomit a lot, some people don't. I was somebody who vomited a lot. So at some points, I could be vomiting 15, 20 times a day, which was, obviously not ideal. So I went from when I was younger to having more mild gastroparesis that was treated with domperidone, which is a common drug that's used here in Canada, to in my later years, like in the past 5-6 years, my gastroparesis has progressed from mild to actually very severe. So with that came a lot of hospitalizations and trialing pretty much every single drug that's available in this country for gastroparesis. And things would work and then they would fail, or I would develop reactions to it. It was not a good thing. I was losing weight very rapidly. My health was just deteriorating downhill very fast. I had to have an NJ tube inserted temporarily, and we're kind of at a wit's end of, I'm going to end up having to have a permanent feeding tube. I can't keep food down. I'm in pain all the time because a lot of times you'll get gas, bloating, pain when you try to eat anything, or sometimes even just trying to drink anything. So that's, I was at kind of the end of everything, trying to figure out what to do. And I thought, well, everything else is kind of not work. So what do I have to lose? Let's see if medical cannabis might be a thing. And thankfully, when my journey started with that, things started to get better.
Wow. It's gastroparesis is a horrible disease to have, but you explained it fantastically, and your understanding of it is very impressive. You explained it just like a doctor would, so that's awesome.
It comes from the years of experience, I think.
Yeah, absolutely. You know it well. So you went to the medicinal cannabis, and so then how did you go about getting medicinal cannabis? Was it your physician? Did you go to a cannabis clinic? Did you decide just using recreationally first? What was your process to getting the cannabis?
So the process was basically, I had kind of known that it would help a little bit because I had tried it a bit recreationally before. So I wanted to go and try it medically and see if it would really help. So I brought it up to my family doctor first, who shut me down because he was very uninformed and very much against cannabis in general. So he was of no help to me. But I thankfully have a wonderful gastroenterologist. So when I went to an appointment with him, I mentioned it, and he was very supportive of my decision to want to try it. And at that point, really, I had nothing to lose. It was try this or, surgery for feeding tube. So let's try this. So what he did is he filled out a referral for me to go to, at the time it was called the Trauma Healing Center Clinic. They're now Harvest Medical, and referred me to a doctor there to kind of explore medical cannabis options. So once we submitted that referral, at that time they were very busy. So I had a 3 to 4 month wait to get into the clinic. But I was able to be seen. And when I had my appointment, I met with a doctor who had been, trained to know about medical cannabis. He listened to me, and he agreed that medical cannabis would probably benefit me and help me in treating my symptoms, especially the nausea, the vomiting. So that's what we did. And from there, I got signed up with the LP and started that process. So that's kind of how that went.
Mm-hmm. And so what type and format of cannabis did you use to start with, the dried leaf or the oils or the capsules?
So for me, like capsules aren't the best option just because of the gastroparesis and the delayed emptying, things like that. And I found even using, I've tried the oils, and sometimes those can be delayed for me. Like if I need relief from my nausea, I vaporize flower because that gives me almost an instant relief. With the oils, there can be a longer onset time. Yes, you usually get longer relief with it, but when I'm really nauseous, I don't really want to sit there and wait for 45 minutes, an hour or longer for an oil to kick in. I just want my relief. So mostly I do use the flower, I vaporize, but I also, I do make my own oils, so I do use them from time to time for more long-lasting relief, like at night, to help with pain and to kind of help relax the body. And that's pretty much, flower's pretty much my main format, and that's kind of what we had discussed at the clinic too, of like with the delayed gastric emptying, different sort of methods probably wouldn't work the best for me. So that's kind of how that was determined.
Yeah, no, I think that's very appropriate, and it concerns me because as medicinal cannabis is going around the world, because there's this negative perception with smoking or vaporizing. Many countries are saying capsules and oils only, but that's not necessarily the most appropriate treatment, especially for someone like yourself with gastroparesis. Dried leaf is the right format. And so I worry that, those patients are not going to be treated ideally if they're forced to take a capsule when they have gastroparesis. And so it doesn't make sense. So I'm glad that you had access to that and that's, I think that's a very smart way to approach it. Did you notice, so you said you noticed that it helped you. So can you describe how you responded to the therapy with medicinal cannabis?
Yeah, sure. So when I first started, it was a bit of kind of trial and error to find the appropriate strain. And as you were mentioning before, with the appropriate terpenes, it's things that I started researching and learning a lot about. So with that, and I've been through a few different LPs, so we go through that trial and error every time. But once you kind of find what works for you, like for me, I'll get really, really bad crippling nausea, where I just kind of I can't do anything. And at that point, I have my vaporizer, and I will have a bit of cannabis. I'll have a few puffs from that. And usually I will feel within a few minutes, I can just kind of feel things calming down, and the nausea will start to settle a bit. It doesn't go away entirely, but it definitely makes it manageable. And things like and a lot of us get really bad abdominal pain and things like that. And I find it'll help relax the muscles a little bit, help relax things in the stomach, and just kind of give me a sense of, okay, this is helping. This is definitely more manageable now. And where I said I was vomiting anywhere to up to 15 to 20 times a day, that doesn't happen anymore. I still get flare-ups from time to time that are bad, and I will vomit with that. But since using medical cannabis, I started a few years ago, the episodes with vomiting and all that have decreased to be almost non-existent. So that's pretty incredible.
Definitely. Have you noticed any side effects with medicinal cannabis or any safety issues in terms of your work or has it affected your life adversely or things like that?
I wasn't really worried about any side effects because I'd already experienced all the horrible side effects from pharmaceutical medications. So I figured cannabis wouldn't be as bad. I can't really speak to driving or working because those aren't really things that I'm unemployed, disabled, and I don't drive. But when I'm medicating, I'm not altered. Nobody really knows that I'm using cannabis because I'm 100% myself. It doesn't affect me in any kind of negative way. It doesn't impair me at all. The only thing I would say that would be a side effect, that a slight negative would be, you get a bit of dry mouth and dry eyes once in a while, but I'll gladly deal with that for the trade-off of the symptom management.
Definitely. All right. Okay. So Jen, I'll get some final conclusions to you from you at the end of the webinar. But we'll move over to Clint now. So, hi, Clint. How are you?
Good, Doc. How are you?
Good. Good to talk to you. So, can you tell me just a bit about yourself? Who you are and what kind of gastrointestinal illness that you have.
Okay. My name is Clint. I'm 39 years old. I was diagnosed with Crohn's disease in 2017. So I'm kind of new at this game, but my whole life, I do believe I had irritable bowel syndrome. At least that's what the doctors chalked it up to be. And just one day at work, I just never felt good. I'm like, oof, I got a stomach flu. And I was just puking nonstop and running to the bathroom nonstop. And it came to the point where I got to go see a doctor. So went to the hospital a few times, and they chalked it up to be a stomach flu. And then just after about 3-4 months, I was down like 65 pounds. And I said, this isn't a stomach flu. There's got to be more to this. So I just kept pushing for tests. And I guess in October of 2017, they did the scope on me and then ruled out to be Crohn's disease.
Mm-hmm. So it's Crohn's disease. So then you started on some pharmaceutical treatment for the Crohn's disease. But what motivated you to start using medicinal cannabis?
Sorry, say that again.
Just ready. So I imagine that with the Crohn's disease diagnosis, you were started on some medications for Crohn's disease. Is that right? Yeah. Right. And so then on top of those medications, what was sort of how did medicinal cannabis come into play? Like when did you start using this in your disease therapy, and sort of what was sort of the motivations for starting medical cannabis?
I was always a recreational smoker. Just like on the weekends, you go camping and stuff like that with the guys. And when I first got sick, it also knocked out my thyroid disease. So I took probably, I guess, a few months off from recreational marijuana until things got settled down a bit. And I just noticed one day, I said, you know what, I was all stressed out. And I said, I'm going to go for a puff outside. And I came back inside. I'm like, I feel somewhat normal. I'm like, no, this can't be happening to me. So whatever. The next couple of days, I'm like, I'm going to try it again. So I went outside again and had a puff behind the shed. And I come back inside. I felt normal. I'm like, well, this has got to be, a coincidence kind of thing. And then talked to the GI about it, and he recommended it. And I said from there, I just started using it and noticed that it worked with no ill repute, and that was it. Here I am.
That's good. So what type of medicinal cannabis did you use? Was it the dried leaf, like the flower that you used, or did you go for the gel caps or the oils or tinctures?
I tried everything. I've tried the oils. Just like Jennifer was saying before, you pretty much want that instant relief. Like you don't want to wait that half an hour, 40 minutes for anything to kick in. So I did try a whole bunch of different methods, but I think the one that works for me the best would be vape and dry flower.
Vape and dry flower, yeah. And then you said no ill repute. So does that mean you didn't have really any major side effects at all, Clint, or were there any things that sort of affected your quality of life using medicinal cannabis?
No, and just like you're talking about, doctor, there's different strains of cannabis. Like there's your sativa, which I found helps me. Like with any chronic illness that anybody has, there comes like depression and anxiety and all that stuff that kicks in. Mm-hmm. And I noticed like throughout the day, is when your mind starts to think, and then you start feeling depressed and anxious and stuff like that. So that's where I would use more of a sativa blend, which I found helped with the anxiety due to my Crohn's disease. At nighttime, I would use more of the sativa where I'm not really active, I'm not at work, I'm not driving. I'm pretty much at home, cut the grass, and that's why I would medicate using a heavier indica to give you that body, to give you that body relaxation and just sit on the couch and watch TV and just kind of melt your worries away kind of thing.
So it sounds like, Clint, you were, especially having some experience with cannabis beforehand, you felt seems like you felt quite comfortable to, trying different strains, figuring things out, and finding what worked for you.
Right. There's so many strains. There's so many different levels of cannabis is that you really have to experiment. Like there's a lot of times where I would mix a sativa with an indica to give me best of both worlds. You know what I mean? Mm-hmm. On days that I'm feeling really, my big symptoms are nauseous and abdominal pain. So if the pain is super bad, I would use a heavier blend of indica. Whereas if it's not so bad, but I feel nauseous, then I'll kind of mix the two. Mm-hmm. If that makes any kind of sense. Like you have to play with it quite a bit in order to get what works for you.
Yeah, definitely. All right. Well, excellent. Thanks very much, Clint. So we will. Go ahead. Sorry.
No, that's it. I mean, as the side effects, just like Jennifer was saying, you do get the dry mouth, the burning eyes, but other than that, I mean, I sleep like a rock. But when I do, especially at nighttime too, I'll self-medicate pretty heavy on my bad days, and next thing you know, I'm sleeping on the couch, and I just sleep like a rock, and I wake up in the morning like brand new me.
Yeah. And do you feel refreshed in the morning, or do you feel groggy if you use medicinal cannabis the night before?
I would say 50-50. If I'm really sick the night before and I really got to kind of hammer down on the vaporizer, I might wake up a little bit groggy, but nothing that you can't take a quick shower, brush your teeth, wash your face, and boom, you're back at it for the day, right?
Yeah, that's good. All right, excellent. All right, so I'll come back to you, Clint, for some conclusions there at the end. So now we'll go over to our second Jennifer. So Jennifer G. So hi, Jen. Welcome to the webinar.
Hi.
So can you tell us, just give us some background info, tell us who you are and what symptoms you have, like what kind of GI symptoms / diagnosis that you're having that brought you towards using medicinal cannabis?
Mm-hmm. Well, you are my doctor, which is amazing.
I know already. Yeah.
No, and it's been an amazing experience. I pretty much have lost all hope. I'm only 27 years old. I've been dealing with this for probably about 3 years. It started pretty much out of the blue one night, and I woke up in the middle of the night with nausea, diarrhea, stomach cramping. It was unreal. I stayed up all night and got no sleep, and it continued for about a week, and then it would start to come and go. I had originally went into an emergency. They thought it was my appendix. I had ultrasounds done. They found blood in my urine. Nobody really gave me any answers for that because they couldn't even find my appendix. There's nothing wrong with it. Mm-hmm. And then my family doctor referred me to you, Dr. Schneider, and we started doing test after test after test. I was taking quite a few different medications at one point, and I think we figured out with that small intestinal bacterial overgrowth test that I had that. Mm-hmm. Tried taking the expensive medications for that. Nothing really solved my problems, but we started with the medical cannabis pretty early on, and it has just been my go-to.
Mm-hmm. Yeah, absolutely. And so go-to for which symptoms? What do you feel is the medicinal cannabis is targeting in terms of your symptoms?
Definitely the nausea. I can relate so strongly to everyone else with the nausea. It was to the point where I was being hospitalized for dehydration because I couldn't ingest fluids or even food to try and get where I wanted to be. I was just self-treating with Gravol before I met you.
Mhm. Mhm. So what type and format of cannabis are you using, Jen?
I use all varieties. Mainly, obviously, the flower vaporizing because you get that instant relief from feeling like you just don't want to be anywhere anymore. And the oils do help during the day, while I'm at work because I find that the THCs will just kind of make me a little more ditzy, if you will. It definitely does alter my mind. I prefer a sativa, something that will keep me more alert, but definitely having THC in the flower helps when when my world starts crumbling down around me and I can't even leave the house because I'm afraid.
Definitely. So that's good. And did you had any negative side effects, Jen, from the medicinal cannabis?
I gained back all the weight I lost just from having like an appetite, from having my appetite back. It stimulated my appetite. It controls the nausea. The only other thing, being tired from a stronger indica and just dry mouth. I don't have any major concerns.
Okay. And do you find, so you're talking about appetite, so do you find it brought your appetite back to normal, or do you feel it gave you the munchies and gave you too much of an appetite?
It really depends on how much I'm ingesting on that. I can definitely have an evening where I'm really not feeling well and I'll medicate myself until I finally feel normal, and then I'm like, oh, I'm kind of hungry.
Yeah.
So you have a snack. Like, what are you going to do about it?
Yeah, definitely. So you think if you were not feeling nauseous and you did not use cannabis, you would not be having a snack? Or do you think it's just because you hadn't eaten some before and then you were hungry because you hadn't eaten some before?
Totally.
Which one do you think it is?
I don't snack unless I've had like a really strong indica that has just brought my appetite out like a bear.
Yeah. Okay. No, fair enough, for sure. And has it compromised your job or your social interactions at all, Jen?
Not at all. All of my employers have been really open. I've been so open and honest with them that they know everything and they know how I treat myself. And as long as I'm coming to work and performing up to their standards, they don't have any issues with it.
And so, Jen, it's I guess this is more of a specific question, but just because I know that you could share some insights on this. So, what do you do when you travel with internationally to when you cannot bring your medicinal cannabis with you?
It's awful. I have traveled to Mexico and I've crossed the border into the United States, and I just take Gravol every few hours and go to sleep really early so I can wake up and try to feel normal.
Okay.
Yeah.
So you find that how long do you feel like? Do you find the effects wear off quite quickly, or do you feel it only comes on after a few days being outside of Canada?
Oh no, it was immediately. Like anxiety kind of heightens everything. Just going above and beyond and knowing that you don't have it and there's nothing you can do about it. It totally heightens all of my symptoms, but I've been learning how to deal with that too.
Definitely. So to what level do you feel medicinal cannabis has got you to in terms of controlling your symptoms? Do you feel that you're 100% better, 80% better, 50% better? Where would you say you are?
I'd say at least 50% better than where I started, like when we first met, because I can go probably half of a day. Like I can go my whole work day without having any cannabis, but getting home into the evening hours, it's usually iffy. I might not have dinner every day just because I'm nauseous, but if I can use my cannabis, it's not usually a problem.
Okay. So if you do use cannabis, you're usually okay. But if you have lapses, you're saying that things go bad pretty quickly. Okay.
Yeah.
All right. Okay. So great. So let's go with some advice. So Jen, I'll come back to you, Jen G. So we'll go back to Jen O. So could you just sort of leave the audience with some advice from an experienced user and obviously someone very knowledgeable in gastroparesis, just sort of share your insights and things that you think people who are considering or potentially already using medicinal cannabis should know.
Yeah, sure. So in the past few years, since I've become a medical cannabis patient to treat my gastroparesis, I've been through kind of a few different licensed producers, and it's a bit of a process, and it's a trial and error process kind of with each LP. That's something I've kind of learned along the way, is that each licensed producer kind of has different strains. They have different levels of terpenes and cannabinoids. So, there's a strain that might be helpful at one LP that could be different at another. So it's just really do your research. And when you can find, like for me, I know kind of the terpene profiles that work best for me. So I try to, get the strains for that. But just remember that there's no one size fits all when it comes to using medical cannabis. I might have a strain that really helps me, but another person it might not do anything for. So that's why it's really important to just kind of keep track of everything. So when you find, that right strain, the right dosage, and all that stuff to, treat your symptoms, you have that kind of written down somewhere that you can go back to. When you're just starting out, you're going to probably be overwhelmed because there's a lot to it. There's a lot of different strains. There's a lot to kind of take in. So one of the things that I used when I first started with my journey of medical cannabis is a cannabis journal. And if you're more tech savvy, there's an app that's called Strain Print that you can use to keep track of your strains, your dosage, the effects, kind of how you feel, how it helped. And that's also a good way to keep track too if you experience any kind of negative side effects. Hey, okay, it was that strain. I need to avoid that strain in the future. Things like that. And just generally, if you're thinking about medical cannabis, if you're thinking that it might help you in your symptoms, go talk to your doctor. I had a negative experience with my family doctor. Not all of them are on board, but, I thankfully had a specialist that was. And just kind of talk to them about it and see if they're not on board, maybe they can refer you to a clinic. And if you are able to kind of start that process, and especially if you're new to cannabis, kind of start low, and like they say, start low and go slow, because you don't know how it's going to affect you. You don't want to be, have a few puffs of something for the first time and just kind of be completely couch locked. You just want to kind of start things a little bit, and that's why it's really important to keep track of everything and how much you have and how it affects you. So that's kind of just trial and error in keeping track is really, really important when you're starting your journey with medical cannabis.
Excellent. And Jen, just in case there's other people out there with gastroparesis, I know everyone reacts differently, as you and I totally agree with that. But can you just give them a starting point? What strains did you find that were the most helpful for you?
For me, I'm with CannTrust for my licensed producer. So I'm using a lot of blueberry kush because that has a high content of limonene, and limonene is a terpene that will help with the stomach. So I utilize that a lot, and I utilize there's like a 1-to-1 strain that's a CBD THC strain called Pennywise. I use that one fairly often as well because I do find the CBD can help with the nausea, and that that's one of the biggest things with the gastroparesis patients, the nausea, the vomiting, and I find. Now, this I wouldn't recommend necessarily for somebody that might be a novice cannabis user, but for me, when the pain gets really bad, I do need a strain that's a bit higher in THC, and CannTrust has a wonderful strain called Gold Kush that really, really helps knock out the pain, and I use that more at night to kind of help me sleep and keep everything at bay for the night. But those are kind of my go-to strains. There's a few other ones, newer ones that are good. I think they're more proprietary to CannTrust, though. Like they have Sunburst, and a sugar bush. Those are two newer strains that both I found helped a lot with my nausea. And sometimes, don't be scared to try to mix a couple strains like together too, especially sometimes CBD, THC, if you need that like 1-to-1 ratio, just to see if that would help. Don't be scared to experiment a little bit with your strains.
Excellent. No, that's great. That's great advice. Excellent. So Clint, can you give us some final thoughts and give us some advice for people with Crohn's disease who might be interested in using medicinal cannabis?
Yes, I think Jen pretty much summed up everything. What I notice is if you're first trying it out, definitely start slow. You don't want to go guns a-blazing because you won't like it. A lot of people feel that when you do self-medicate with cannabis, you do have that feeling of anxiety. And to me, that was all mind over matter. You have to let the cannabis has to work for you. Don't try to use your mind against what that drug's trying to do for you, because that's when everything starts to go haywire, right? Usually when you're self-medicated, you're only in it for a few hours, and then it kind of goes away, almost like a Tylenol would, right? The effect lasts for so long, and then it goes away. But definitely start slow. You probably won't like it the first time you do it, but just keep trying it. And if it's for you, it's for you, and if it's not, it's not. And at least you can say you tried it. What I do like about cannabis too is that you can't overdose on cannabis. At least I don't think you do. Whereas if the pain was so bad in my stomach, I would smoke a little more heavier strain and more of it, and not have the side effects of your pharmaceutical drugs where, just start slow and it is what it is, and just go with it, and hopefully it works for you, because it does work for me and it does work for other people. So.
Mm-hmm. Yeah, you're absolutely right, Clint. I think I agree with you about the overdose. So there's no documented deaths from overdose in cannabis in the history of medicine, and so it's or the history of the plant. So it's a very safe medication, which you can't really say that about anything else. I mean, if you take too many Tylenols, you will die. And so it's very safe, but you can feel quite uneasy for a long time if someone did take an overdose, especially if they were a newer user. And sometimes, it just goes away after a while. You're right, but it's a very uncomfortable feeling for a while. Do you have any advice, Clint? You seem like Jen as well, that you have quite a bit of experience, with different strains and even mixing strains together. Do you have any advice for stuff that you found was helpful in Crohn's disease as far as strains go?
Strains, I mean, the CBD, a lot of people don't like that euphoric feeling. A CBD strain won't give you that euphoric feeling. If I'm going to work or I'm doing something where I got to kind of focus, I will smoke more of a CBD to ease the pain, but yet my mind is clear. Depends where I am in the day, like nighttime, when the kids go to bed, I will smoke. When I say smoke, I don't do this every day. It's just kind of when my symptoms appear. And it was just the other day there where I got this one off a website. It was called Death Bubba. And a lot of these sites, it'll show you what this strain is meant for. And one of them said nausea, and that's one of the symptoms I have the most would be nausea. And it was 31%, and I knew that was going to be high, and probably one of the highest ones I've ever tried. And I said, I got nothing to lose. I'll try it. I mean, keep in mind, I've been smoking marijuana recreationally for 20 years, so I smoked this stuff, and it was just like, to me, I couldn't feel my feet. My whole body was just numb. I'm like, okay, this is good. And within about half an hour, 45 minutes, the effects start to wear off, and you have a bowl of cereal and good night, Charlie.
That's excellent. All right. Good stuff, Ed. All right. So Jennifer G., so can you give us your conclusions and advice to people thinking about using medicinal cannabis?
Educate yourself. Read every bit of information you can, and ask your doctor questions, because at the end of the day, they have your best interest in mind. Definitely understanding the difference between the CBD and the THC and how they work and the different forms and how you can tailor it for your own needs is quite important. Everyone is different, and I really do believe in the positive things that cannabis can do for anyone who's willing to take the time to get educated.
Mm-hmm. And I know we get quite technical when we talk about strains, but do you have any strains that you found helpful for nausea that you would like to tell people about, or did you, or are you have you not identified those yet, Jen?
I have identified like a higher THC will definitely help with the nausea more than a lighter CBD. It really depends on the strain. 1-to-1s are usually like sufficient enough, but on the really bad days, I definitely go for a higher THC content.
Mm-hmm. Okay, excellent. All right. Okay, short and sweet. So, all right. So then, I see this other slide. I think this is Jennifer O. You'd like to talk about this.
Okay, we're going into the charity stream, I think. Yeah.
Yes, exactly.
I don't know if Kelsey wanted to do this or wants you to.
I'll let you explain it, but I just wanted to put this in here just before we get to our Q&A session. That CDHF is super excited because we're doing our first ever charity stream on Twitch this Saturday to raise money for those living with gastroparesis. And what's really cool is that Jennifer O. from this webinar is actually the one who will be playing the game. So, Jennifer, if you want to just give a little bit of information on Twitch and what's going to go down on Saturday.
Yeah, for sure. So a lot of people are not familiar with what Twitch is. It's basically like YouTube, but it's live, and you can chat in real time with the people who are playing games. I've done charity live streams for other things in the past, but this is going to be our first one for gastroparesis. So basically what I do, my husband and I do these charity streams. I play a game for a few hours, and then he kind of takes over and plays for another few hours. So what I'm doing is something called Twitch Sings. So it's basically Twitch's karaoke game. So we have a bunch of different incentives and goals and things like that that'll be happening throughout the stream, like for $15 donation, you can do song requests. $10, I'll play the songs without lyrics, things like that. My husband's going to be playing Destiny 2, and we have some stuff going on for him. He's the one who gets to be tormented the most during these charity streams. So he's going to be doing things like every $100 raised, where he's going to be eating baby food. We have things like Bean Boozled, which is basically a jelly belly thing, where it's a 50-50 chance of eating a good one or a rotten one or a bad tasting one. Those are donation incentives. So all of it's happening on Twitch, made possible through Tiltify, which is a charity streaming platform. And it's going to be happening all this Saturday at 1 p.m. Eastern, 2 p.m. Atlantic time on twitch.tv/Australia. So you can come hang out as we're raising money for gastroparesis research and awareness initiatives.
Yay! So yeah, we're very, very excited for that. So make sure you tune in. So with the time we have left, we'll get to some of the questions that came through. So I think this one will be for Jennifer O. and Clint. Amy asked, did these patients continue with other prescribed medications for gastroparesis and Crohn's in addition to cannabis use, or did they stop other medications? So we'll start with Jennifer O.
Yeah, sure. So for me, personally, there was no other medications for me. All of the medications that were available failed me. So medical cannabis was kind of my last option. So I just treat with medical cannabis with no other pharmaceutical medications.
Yeah, and so from a doctor's perspective, you'll try to use as many medications. You'll use many medications as needed, but if cannabis, the medicinal cannabis, is taking care of the majority of the symptoms, there's no need to double medicate. So it's a case by case basis. Obviously, the goal, even with medical cannabis, is to minimize the use as much as possible and minimize the use of medications, because there's polypharmacy there can be side effects. And so if you can get away with only one medication, then that's what you'll do.
Cool. And Clint, did you want to just add your info for Crohn's disease? Is he still on? I think we've lost Clint. Okay, I'll go to the next question.
Sorry, I had it on mute.
Sorry. Okay, go ahead.
So I'm currently on Inflectra, which is an IV drip that I go through every 8 weeks, I do believe. Other than that, I just take your antacids for the acid reflux, and that's pretty much it.
Oh, okay, great. So I think this next question is for Dr. Schneider. Jojo asked, supplies for patients have been a big issue, leaking bottles, including tax in our medicine. Who would be the best person to help us on these issues?
So, yeah. And sorry, Kelsey, I thought you said Chris. I was like, you're calling me by my first name, so that's why I answered that last question, but it was for Clint. I was like,
yeah. That's okay. Your answer was good, too.
Yeah. Yeah. So the question is the taxes on medical cannabis and what approach should be taken to try to get those taxes off? Is that the question?
Leaking bottles, including tax in our medicine. Who would be the best person to help on these issues?
Yeah, I mean it's a frustration for medical doctors, frustration for patients, obviously, and it's frustration for the entire industry. And I don't know. There's all different theories of why they're doing this, but it really does sort of show that the government that introduced cannabis is not you kind of see when they're taxing it what their main goal was in bringing cannabis in. It wasn't necessarily to really help Canadians suffering with chronic illnesses that need cannabis, but more likely a revenue generating mechanism to help them spend. So it's a frustration. There's been significant lobbies, both by the Canadian Medical Association, I believe the Canadian Medical Association. Actually, I don't want to quote them, but I know from the industry there's been significant amount of lobbying. I know at the conference that I went to last week at Lipton Co. in Toronto, that was a big topic of discussion, and industry leaders were, engaging the government as much as possible to get those taxes off, because it's another thing that they have to collect. It increases the price and decreases the access for people, and ultimately decreases their sales. And so everyone in the industry is interested in getting it off. It seems like it's just falling on deaf ears right now, and no one from the government's really responding to that. And they use the justification to say that there's no DIN number, so no drug identification number. Therefore, it means that they can tax it. They don't have to exempt it from taxes like the rest of the prescription pharmaceutical medication. However, they do require a doctor's authorization for it, and the entire industry is regulated by Health Canada. So it's kind of a it's kind of a paradox in how they approach this. And there's a lot of it's a lot of hypocritical behavior. So it's I think it's something that's eventually going to come off. They can't continue to do this, but I think they're going to try to tax it for the next few years until there's enough people on medicinal cannabis that there's enough of a voice that it makes sense for them politically to take it off.
Okay. So I think we just have time for one last question. And Jojo asks, what strain includes terpenes? What strain of terpenes would you recommend for gastroparesis?
So this is probably for Jennifer O. Is that this question's for?
It could be for you and for Jennifer O. Yeah, we can start with Jennifer O.
Yeah.
Sure. As I kind of said earlier, strains that are higher in limonene content, I usually look for that as a primary terpene, as that is one that helps a lot with the stomach. There's a bunch of different strains that are higher in limonene, depending on which LP you're at, of course, because strains, as I said, can vary from LP. In my experience with the different ones that I've had, I think Blueberry Kush is higher in limonene. And Girl Scout cookies. I know at some point there's the Pink Kush. So there's definitely, if you're looking for something that'll help more with the stomach, I think most LPs have their terpene profiles available, and just kind of check for strains that are higher limonene content. That's been my experience with it anyways, that those have been more helpful for me in treating my gastroparesis.
Mm-hmm. I agree with that, and I find a lot of patients using the Kush strains shows a benefit who have gastroparesis, and the limonene is good. The mycene seems to be also helpful as a terpene, but the pinene seems to actually make some people worse, and so that this is like just purely anecdotal of what patients have been telling me, but the I think speaking of the limonene terpene is much better than a pinene terpene.
Okay, great. So I think we're at 8:01 now, so that's all the time we do have for today. I just wanted to thank Dr. Schneider. We've had 3 amazing webinars in this webinar series. So as I said in the beginning, make sure you check those recorded ones out on cdhf.ca. I also wanted to thank Jennifer O., Clint, and Jennifer G. for taking the time to present this evening. You guys have amazing stories, and we're super excited to be sharing them with other people who are interested in trying medical cannabis. And also just a quick note to thank Spectrum Therapeutics for allowing us to do awesome educational presentations like this one. So that's all the time we have today. So have a good evening, everyone.
Thank you.
Hey, guys.